So with this Donald Trump and MAGA Republican government shutdown, because they don't want to extend the Affordable Care Act subsidies, Democratic leader Hakeem Jeffries did something which I don't think we would think should be political or controversial. He posted a video that said, "Save healthcare." And then it went on to talk about how hospitals will close, monthly insurance premiums will double. It got over 2 million views in the first day. But leader Jeffrey says Republicans have created a healthcare crisis in America. We must decisively address it. And then the words flash, "Save healthcare." To which then MAGA Republican Congress member Tim Burchett responds, "We did not create Obamacare." Then MAGA Republican Congress member Mike Lawler, very critical of this video that Hakeem Jeffries posted that just says "Save healthcare." Lawler goes, "Obamacare was passed by Democrats. The Obamacare tax credits were passed by Democrats during COVID and slated to expire at the end of this year. 3, since Obamacare took effect, healthcare premiums have risen by over 60%. Your failed policies created a healthcare crisis." Then MAGA Republican Congresswoman Marjorie Taylor Greene says, "Democrats created the healthcare crisis in America in 2010 by passing the Affordable Care Act, aka Obamacare. Democrats made it worse in 2021 by extending the tax credits. It's been 15 years. Yes, it's past time to address it by building the off-ramp for Obamacare." And remember how they were always saying repeal and replace Obamacare? Well, what they're quite literally saying here is repeal Obamacare, get rid of it. What existed before the Affordable Care Act and Obamacare was better when there were over 20 million Americans who had no insurance. And if they didn't have their insurance, very bad things could happen to them. And here's the thing. Donald Trump was in office the first time. He had 4 years to come up with the plan. Remember, every 2 weeks he said there would be a plan, a healthcare plan. 2 weeks, 2 weeks, 2 weeks. I've got a plan coming in 2 weeks. Do you even remember as the 2020 election was approaching, he did that interview with Leslie Stahl, I think her name is, of 60 Minutes. And they brought out the binders and Trump said, "That's the plan right there." And then Stahl looked at the binder and it was all just a bunch of blank pages. It was quite literally a fake binder and they never came up with the plan. Well, we're 9 months or so into this regime right now. They haven't come up with the plan. Every few months, Donald Trump will post something on his social media platform and say, "We're implementing a most favored nations provision where your prescription drug prices will now cost as low as the lowest price that pharmaceutical company charges people in another country." So if they charge $1 in Canada, they'll have to charge $1 in the United States. Now, that would be great if it was real, but Trump said that took effect in May. It did not take effect in May. It was just yet another lie. He also posts AI images of magical alien technology from outer space called medbeds, which doesn't really exist. It's part of a deranged conspiracy, and says, here are these secret beds that the aliens are using and that this will help you cure all of your illnesses. He deleted it after posting it for about a day. And then he consistently says, "I'm reducing your prescription drug prices by 1,600%. It's impossible to decrease something by more than 100%. It would quite literally mean the pharmaceutical companies would be paying you for taking their drugs." Then on Monday, MAGA Mike Johnson was asked by a reporter, "So do you support repealing Obamacare? What's your healthcare plan? So what's your plan? Just lay it out. Tell us, what's your plan? I mean, if you don't like universal healthcare, which by the way, I like, if you don't like Obamacare, which the subsidies keep the prices reasonable, still high. We could still have criticisms. The Republicans are the ones who keep trying to make it more costly and more difficult and not working to improve it. Okay, what's your third plan? What is it? Is it before Obamacare?" Watch what MAGA Mike said. Let's play it.
President Obama, you've been very critical in recent days of Obamacare, and some of your members have called for repealing it. Do you support repealing Obamacare, and what's your health care plan?
We worked on repealing and replacing Obamacare back in 2017. I still have PTSD from the experience. You remember that John McCain famously did the thumbs down and effectively by a 1-vote margin. The whole effort was defeated. It's a great frustration of mine, and has always been of President Trump's. And we know that American healthcare needs dramatic reform. Let's just state it simply. Obamacare failed the American people. It was promised to be a great success, to make healthcare more affordable. It's done exactly the opposite. And it has been pointed out by everyone that since Obamacare was created in 2010, premiums, the cost of healthcare, have risen exponentially. It's skyrocketed to the point where it's no longer affordable for so many Americans. And the access to care has been reduced, and the quality of care in some regions of the country has been reduced. We have to reverse all of that, and we have plans to do it. The Republican Party is the party that has the plans to fix it. Can we completely repeal and replace Obamacare? Many of us are skeptical about that now because the roots are so deep. It was really sinister the way, in my view, the way it was created. I believe Obamacare was created to implode upon itself, to collapse upon itself. I think the people who drafted that, the architects of it, knew that it would not be sustainable because their objective was ultimately a single-payer system. They wanted full government control of healthcare. That's a terrifying prospect for those of us who believe in low-cost, high-quality care. And so we have lots of ideas on how to fix it, but it is very, very complicated.
All right. He does not come up with a plan. He just does what maybe you did in high school, where you didn't do your research assignment and you show up and you just try to BS it and hope maybe the teacher doesn't know. It was just more word salad like that. But I want to talk to real Americans who are incredibly worried about these Affordable Care Act subsidies expiring, people who have relied on the Affordable Care Act to live, and that this is not just some political issue. This is life or death. So I want to bring in right now somebody by the name of Amy Bielawksi. She's a small business owner, uninsured for most of her life, 60 years old, and the Affordable Care Act subsidies and the Affordable Care Act allowed you to get a health care plan. You shared this with me, and I'm allowed to share it publicly. You had a thyroid and have a thyroid disorder. So this is critical for you to live. And so I want you to respond first when you hear somebody like Mike Johnson say that it gave him PTSD to not repeal Obamacare back in 2016, and that was a PTSD experience for him. What do you say to the politicians in White House right now, in Washington right now, who want to get rid of Obamacare?
Well, if people like me have gone without health insurance for most of their lives, and technically I really only had it for 4 years now, since 21, then, and it's going to go away, and obviously I'm going to get older and things can happen more to one's body, then yeah, it's a little frightening to say I can't afford healthcare now because you're taking it away from us again, the richest country in the world. So seems odd. Seems something's unbalanced here, that you don't care about the people who live here.
You know, he acts like there was something before the Affordable Care Act where it was great for you and others, that before the Affordable Care Act, that somehow the Affordable Care Act created the problem. But it was because of the subsidies in the Affordable Care Act that you were able to access healthcare. Before, you were unable to access healthcare.
Right. I remember actually calling an insurance company agent at some point. I don't know. I was in my 40s at that point. I mean, they were quoting me $450 a month. As a small business owner, I can't afford that. My business is very seasonal. Some months I might sadly only make $800. So I have a $5,000 property tax. I have $1,000 mortgage on insurance on my house. Those months I can't pay that. So yeah, 450, even 120, it's going to be probably too much for me.
Not to mention, things are getting more expensive now too. I mean,
Right.
In general, groceries are more expensive, and you know, as someone who lives on a on an income, as you said, where it could be $800 a month one month, it could be less another month, it could be more. What's going on there right now, just day to day, you know, as things are getting more expensive? Just take us through the quality of life right now under Trump.
Well, it's stressful. I mean, it's been stressful from day one that he got sworn in. And I don't think I'm here to tell you that news. Everybody knows that. So, you know, he's trying to create stress and chaos every day. And that's what he did the last time around. But this time it's like twice as bad. So threatening American people with something else it's enough to be able to just live in your own little world and deal with your own stresses and your own business, and then have to deal with the whole country falling apart. And we're going to slash this now, and we're going to take this away, and we're going to start going after people who don't like our policies. I mean, yeah, scary and stressful.
For you, with the thyroid disorder that you have, with medical issues you have, I mean, the Affordable Care Act is something that you come to utilize and rely on in order for you to live, just to live, basically. I mean, to live, to live a quality of life that makes life worth living. Like, am I exaggerating it there, or like I'm trying to express in terms what the Affordable Care Act means to somebody like you in terms of, and the subsidies being able to deliver healthcare for you at your age with the thyroid disorder?
Well, I mean, and that's just a small part, you know. I mean, I have my stuff that happens to me. I'm still an entertainer. I still have to work. I can't go without a prescription now because I will, you know, my hair will fall out. You could gain 20 pounds in a month. You can't get out of bed because you're so fatigued. The thyroid runs a lot of things in your body. And that was diagnosed in 2008-9. So I went without real health care, you know, from 2008-9 until 2021. And I had to be creative, and I had to go to the health centers, the community health centers, to get, you know, coverage. Well, whatever coverage it is, so that I could get a prescription. So if you don't have the availability of going to a doctor through insurance, you have to either pay out of pocket, or you have to see a doctor you don't know who it is, and that's who you get. And that's unacceptable to me at this point in my life. I feel like we deserve better now.
So finally, what's your message to the lawmakers in Washington, D.C.? Many of the Republicans aren't even showing up right now. They're on a paid vacation right now while the government is shut down. What's your message, though, to lawmakers who say that, you know, we want to repeal Obamacare, get rid of it, and they don't have a plan? What's your message to them right now?
Well, I mean, if you had something better, then please, let's show it. But obviously they don't have anything, and they've displayed that for a long time now. I'm glad that the Democrats are holding out for some of us, that, you know, 20 million people who still need it and will only get insurance this way. And maybe the best health care we can get, which is minimal at best. We take the scraps that we're given. And if the Republicans think that's okay and how they treat their constituents, then, well, good luck.
Amy Bielawski, thanks for joining us. We appreciate you.
Thank you.
Everybody hit subscribe. Let's get to 6 million subscribers.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.